Whilst calls have been made for stronger measures which alluded to a total lockdown of the nation's capital to mitigate the spread of COVID-19, the negative impacts of such measures on the bulk of the population had also to be taken into consideration. Controller David Manning has issued 10 new COVID-19 measures as of this week. These include the revocation of previous measures, international and domestic travels, provincial coordination, burial of deceased persons, customs duty, COVID-19 testing and surveillance, as well as business and social, the latest measure being mandatory mask wearing in Port Moresby. Businesses, schools, public motor vehicles, restaurants, offices with the inclusion of everyone else in the city are expected to make it their business to ensure these strict measures are complied with. The use of alcohol, sanitizers, temperature checks, social distancing and wearing of masks all mandatory as of this week going forward. As of yesterday, one more new case was identified in Port Moresby, now bringing the total of the confirmed cases up to 32. Port Moresby General Hospital is picking up cases as they are doing tests on staff, patients and guardians, this indicating community spread and more cases are expected. Recently, the St. John ambulance has been inundated, responding to a number of respiratory cases across the city.
We've seen a large increase in call volume in the NCD in the last 24 to 48 hours. A number of those cases have been COVID-related cases, and we've also seen a general increase in respiratory illnesses that we're being called to. So far, we've transported 19 people to the facilities around NCD who are being treated for COVID-19. This is a real stretch for us at this time. We operate 5 to 6 ambulances a day. We're asking for support from NDOH to increase an extra 2 ambulances so we can staff them purely to support the COVID-19 activities that are happening.
Canon calling for patients, vital support and cooperation from everyone during these busy and unsafe times, and that the ambulance service is doing its utmost best to attend to every call of cases coming in.
Thank the community for understanding that at this time we're immensely busy. So our key message is if you need an ambulance because you are very unwell, you should call 111. If you can make your own way to hospital at this time, we ask people to try their best to make their way to hospital. If you are suffering respiratory symptoms, a sore throat, cough, fever, even a runny nose, if you've got those symptoms, we want you to go get tested. If you need medical treatment, make sure that you tell all the people that are caring for you that you have those symptoms so that we can wear protective equipment when dealing with you. The last thing any of us wants is an ambulance officer or a nurse or a doctor falling ill with COVID.
Annette Kora, National EMTV News.